Hello, dear friends. How are you feeling today? If you are living with diabetes, I understand that it is not easy. There are days when you feel extremely tired, your hands and feet are numb, and your blood sugar keeps fluctuating even though you are taking your medication and following a strict diet. Have you ever asked yourself, is there something being overlooked? Imagine this. You wake up in the morning and realize that you cannot get out of bed without someone's help. You feel weak, achy, and mentally exhausted. A worrying truth is that during the time you are watching this video, nearly 40 seniors around the world will be hospitalized due to complications from diabetes. But there is good news. There are essential vitamins that have been studied and proven to help stabilize blood sugar, reduce complications, and improve your energy, nervous system, and heart health. Today's video will show you the 4 most important vitamins that people with diabetes should never lack. And the last one might surprise you. If you have ever felt exhausted, got sick easily, or struggled with wounds that heal slowly, do not take your eyes off this video, because by the end, I will help you understand which vitamin your body is truly craving. Vitamin D, the forgotten key to managing diabetes and protecting your overall health. Dear friend, if you are living with diabetes, there is one important fact you need to know right now. You are almost certainly deficient in vitamin D, even if you are unaware of it. This is not rare. In fact, it is such a common issue that it has become alarming. And you will soon see why vitamin D deficiency has such a serious impact on the health of people with diabetes. Let us begin with a familiar situation. You feel constantly tired, even after getting enough rest. Your muscles and joints feel weak, making it difficult to stand, walk, or perform simple daily tasks. You may notice that you catch colds easily. Small wounds take a long time to heal, and if you check your blood sugar levels regularly, you may notice that your readings fluctuate, even though you have been careful with your diet. All of these symptoms may be signs of chronic vitamin D deficiency. Why are people with diabetes more prone to vitamin D deficiency? First, vitamin D is not mainly obtained from food. It is mostly synthesized by the body when your skin is exposed to sunlight. But nowadays, many people, especially older adults, spend less time outdoors. Or they often wear long sleeves or use sunscreen, which blocks the skin's ability to make vitamin D. For people with diabetes, there are 2 especially important factors that make vitamin D deficiency even more serious. The first is silent kidney damage, a common complication of diabetes. The kidneys are responsible for activating vitamin D so that the body can use it. But when the kidneys are affected by prolonged high blood sugar, their ability to activate vitamin D decreases sharply. Even if you eat enough or get some sunlight, the vitamin D remains inactive and cannot work effectively. The second is the presence of obesity or visceral fat, which is common in people with diabetes. Vitamin D is fat-soluble. When your body has too much fat, it traps the vitamin D inside fat cells, reducing the amount available in your bloodstream. As a result, your body suffers from vitamin D deficiency, even when the total amount of vitamin D in your body appears to be sufficient. So what happens when you are deficient in vitamin D? Many things you may not expect. First, vitamin D helps insulin work more effectively. It supports the pancreas in producing insulin. It also helps cells become more responsive to insulin, which allows blood sugar to drop naturally. When you lack vitamin D, insulin resistance becomes worse, making blood sugar control more difficult even if you are following a careful diet. Not only that, but vitamin D is also a natural anti-inflammatory. It helps calm systemic inflammation, which is a root cause of many diabetic complications such as nerve damage, kidney failure, cardiovascular disease, and retinal damage. When vitamin D is low, inflammation increases. Blood vessels and nerves suffer more damage, leading to pain, numbness, and a higher risk of vision loss. Your immune system is also heavily affected. Studies show that low levels of vitamin D weaken your immune response, making you more vulnerable to infections, colds, and pneumonia, all of which are more dangerous for people with diabetes. Moreover, vitamin D affects your mood and nervous system. It is not uncommon for people who lack vitamin D to feel depressed, have trouble sleeping, or experience memory problems. So what should we do? Fortunately, improving your vitamin D levels is not difficult if you have the right strategy. First, make use of morning sunlight between 7 and 9 a.m. Just 15 to 30 minutes a day, with your arms, legs, and face exposed without going through glass or screens, can help your body produce a meaningful amount of vitamin D. Second, eat a nutritious diet. Fatty fish like salmon, mackerel, and sardines, eggs, especially the yolks, milk, Vitamin D fortified plant milk and UV exposed mushrooms are excellent sources. For vegetarians, mushrooms and fortified foods are practical choices. If diet and sunlight are not enough, taking a vitamin D3 supplement is an effective solution. For people with diabetes, a common dose ranges from 1,000 to 2,000 IU per day. However, if you have a severe deficiency, your doctor may recommend a higher dose for a short time. You should also ensure that you are getting enough magnesium, because magnesium helps activate vitamin D inside the body. Do not forget to check your blood levels regularly to monitor your vitamin D status. The ideal range is typically between 30 and 50 nanograms per milliliter. Always consult your doctor for the right guidance. As you can see, a small nutrient like vitamin D can make a huge difference in the journey of managing diabetes. By understanding it correctly, supplementing it properly, and maintaining it consistently, you are building a strong foundation for a healthier body, a clearer mind, and a more peaceful life, despite this chronic condition. Vitamin B1, thiamine, the silent friend that protects your nerves, heart, and glucose metabolism. Dear friend, when we talk about diabetes, we often think of cutting back on starches, taking medication regularly, and checking blood sugar every day. However, there is one extremely important factor that often gets overlooked. That is vitamin B1, also known as thiamine. This is a type of B vitamin that plays a crucial role in converting glucose into energy. For people with diabetes, thiamine deficiency is not only common, but also particularly dangerous if not detected and corrected in time. There is an important fact to note. Most people with diabetes are deficient in vitamin B1 to varying degrees, from mild to severe. The reason for this lies in the nature of the disease itself. When blood sugar remains high for a long time, the kidneys must work harder to eliminate the excess glucose. During this process, vitamin B1 is also flushed out. Furthermore, chronic inflammation and oxidative stress in the body consume thiamine faster than usual. On top of that, diets low in whole grains or high in refined foods further reduce the amount of thiamine absorbed into the body. So what happens when your body lacks vitamin B1? First, you may experience persistent fatigue because thiamine is the key to converting sugar into energy. Without it, your cells starve for fuel, making you feel drained and lifeless. But even more concerning are the effects on your nervous system and heart. Vitamin B1 plays a vital role in nerve transmission, so when it is deficient, you may feel tingling, burning, cramping, or pain in your hands and feet. These are symptoms that can be easily mistaken for diabetic neuropathy, but it does not stop there. Thiamine deficiency also severely impacts your heart. A serious condition known as wet beriberi can develop when vitamin B1 is severely lacking. It causes heart failure, leg swelling, shortness of breath, and rapid or irregular heartbeat. For people who already have a high risk of cardiovascular disease, like those with diabetes, this becomes even more worrisome. In the brain, thiamine deficiency can cause memory loss, emotional disturbances, irritability, or depression, especially in older adults. A more severe condition called Wernicke-Korsakoff syndrome may occur if the deficiency is prolonged. This condition causes serious memory disorders and disorientation, commonly seen in individuals with long-term brain damage due to B vitamin deficiency. Additionally, thiamine helps protect the kidneys from damage caused by harmful byproducts of glucose metabolism. Without enough of it, these toxic compounds build up and further impair kidney function, increasing the risk of kidney failure, one of the most serious complications of diabetes. The healing process and wound recovery also slow down, making chronic wounds, especially on the feet, more likely to occur, a common problem for people with diabetes. So how do you know if you might be deficient in vitamin B1? You may feel weak even after eating well, or notice that your hands and feet are gradually getting weaker or cramping at night. You might experience tingling in your soles, slow healing scrapes, frequent irritability, or forgetfulness. If you are taking metformin, a commonly prescribed medication for lowering blood sugar, your risk of thiamine deficiency is even higher. This is because the drug affects the absorption and metabolism of B vitamins. The good news is that thiamine can easily be replenished through a proper diet. Try increasing your intake of whole grains like brown rice, oats, whole grain bread, and legumes such as lentils, black beans, and green beans. Also include sunflower seeds, cashews, pumpkin seeds, lean meats, eggs, and organ meats like liver. These are all natural sources rich in thiamine and are diabetic friendly when consumed in appropriate amounts. If your diet alone is not enough, your doctor may recommend a thiamine supplement, usually in doses ranging from 10 to 100 milligrams per day, depending on the level of deficiency. For those with severe nerve complications, a special form called benfotiamine may be needed. This is a derivative of vitamin B1 that is more readily absorbed by nerve tissue. However, do not take high doses on your own without proper medical advice, as maintaining balance among the B vitamins is very important. Lastly, remember that vitamin B1 does not work alone. For your body to absorb and use it effectively, it should be taken together with other B vitamins, especially B6, B12, and folate. Also, keeping your blood sugar stable is essential in preventing thiamine loss through urine. As you can see, this small vitamin is actually the foundation for your nerve health, heart function, memory, and daily energy. In the journey to manage diabetes, thiamine is a silent ally, but when properly supported, it can make a big difference in your daily quality of life. Vitamin B12, the lifeline for nerves, blood, and brain in people with diabetes. Dear friend, in your journey of managing diabetes, you may have experienced some familiar symptoms. You might feel numbness or tingling in your hands and feet every morning when you wake up. Your mind feels foggy, like there is a cloud over your thinking. Small wounds seem to take forever to heal, and there is a persistent tiredness even though you have not done anything too strenuous. These could be signs of vitamin B12 deficiency, a condition that is common but often overlooked, especially in people living with diabetes. Vitamin B12, also known as cobalamin, is a member of the B vitamin family and plays an essential role in many vital functions of the body. It protects the myelin sheath surrounding nerve fibers, supports blood cell formation, enhances brain function, and indirectly helps regulate blood sugar by supporting the pancreas and the central nervous system. So why are people with diabetes more likely to be deficient in vitamin B12? There are three main reasons. First, many people with diabetes take metformin, a widely used medication for controlling blood sugar. However, a little-known side effect of metformin is that it reduces the body's ability to absorb vitamin B12 in the small intestine, especially when used over many years. Second, diabetes can affect the digestive system. For example, complications involving nerve damage may lead to slowed bowel movement or chronic conditions like gastritis or intestinal inflammation. These issues reduce the body's ability to absorb B12 effectively, even when your diet includes enough of it. Third, people who follow a strict vegetarian diet or avoid animal-based foods are at a higher risk of deficiency because vitamin B12 is mostly found in meat, fish, eggs, and dairy products. When your body lacks vitamin B12, the symptoms may appear gradually, but they can become severe if not detected early. One of the most common signs is numbness, tingling, or sharp stabbing pain like needles in your fingers or toes. This is a sign of nerve damage, a very serious issue for people with diabetes who are already at high risk for peripheral neuropathy. In addition, people with B12 deficiency often feel weak, tired, dizzy, or short of breath. This is because vitamin B12 is involved in red blood cell production and oxygen transport in the blood. A deficiency may lead to megaloblastic anemia, a form of anemia that significantly lowers your energy levels. At more advanced stages, you may experience memory problems, difficulty concentrating, mental fog, or even mood disorders like anxiety or mild depression. Some people also lose their sense of balance, walking unsteadily even when they do not have joint or muscle issues. This is due to damage in the deep sensory nerves. Another critical impact of B12 deficiency is reduced sexual function in both men and women. Vitamin B12 supports healthy circulation and nervous system activity, both of which are important for physical intimacy and emotional connection. When B12 is lacking, fatigue and low libido can occur, negatively affecting quality of life and emotional well-being. But do not worry too much, because recovering your vitamin B12 levels is completely within reach. The first step is a blood test to check your serum B12 levels, especially if you are taking metformin or have symptoms like those described. Normal levels typically range from 200 to 900 picograms per milliliter, but many experts believe that levels below 400 pg or ml can already affect nerve health. If you need to increase your B12 levels, start by adding B12-rich foods to your daily meals. The best sources include organ meats like beef liver, fatty fish like mackerel, salmon and tuna, red meat, eggs, whole milk, and cheese. For vegetarians, look for cereals, plant-based milk, or other fortified products. These usually have a clear label showing added B12. In cases of severe deficiency, your doctor may recommend B12 supplements or even B12 injections depending on how well your body can absorb the nutrient. Injectable forms like methylcobalamin or hydroxycobalamin are often used when the digestive system has absorption problems. Sublingual tablets, placed under the tongue, are another option for those who prefer not to use injections. The common oral dosage of vitamin B12 ranges from 500 to 1,000 micrograms per day, depending on your level of deficiency. Since B12 is a water-soluble vitamin, any excess is usually excreted in the urine. However, it is still important to follow your doctor's guidance to ensure safety and effectiveness. To help your body use vitamin B12 more efficiently, it is also recommended that you maintain stable blood sugar levels. Make sure you get enough folic acid, vitamin B9, and vitamin B6 as they work together with B12 in metabolic processes. Drink plenty of water, engage in regular physical activity, and avoid alcohol, because it can interfere with the absorption of B12. Vitamin B12 may seem like a quiet and modest nutrient, but without it, every cell in your body, from blood vessels to nerves to your brain, is affected. Supplementing with the right amount of vitamin B12 not only helps you manage diabetes more effectively, but it also brings mental clarity, stronger legs, and more vitality in your everyday life. Vitamin C, the immune shield and silent ally in the journey of living with diabetes. Dear friend, when people hear about vitamin C, they usually think of oranges, lemons, and drinking juice to boost immunity. But for those living with diabetes, vitamin C is not just a nutrient to prevent the common cold. It plays a strategic role in preventing complications, protecting blood vessels, improving skin health, and helping the body repair even the smallest injuries. Imagine your body as a complex building. Your cells need protection, your blood vessels need strength, and your tissues require constant healing from small injuries. In people with diabetes, silent inflammation and oxidative stress occur every single day. These are like silent intruders that slowly eat away at your health from the inside. And this is where vitamin C shines as a warrior fighting against that destruction. The first thing you need to know is that people with diabetes are especially prone to vitamin C deficiency, even if they eat fruit every day. Why is that? Because glucose and vitamin C use the same pathway to enter cells, known as the GLUT1 transport system. When blood sugar levels are high, glucose takes up most of the space, preventing vitamin C from entering cells at the right time. This means that even if the vitamin C level in your blood appears normal, your internal organs are silently starved of this essential nutrient. Furthermore, frequent urination, a common issue in diabetes, causes vitamin C to be lost more rapidly than normal. And what many people do not know is that stress, infections, slow-healing wounds, or diabetic foot ulcers all consume a large amount of vitamin C to rebuild tissues and fight free radicals. So what happens when you are deficient in vitamin C? You may notice dry, cracked skin, wounds or scratches that heal slowly, frequent gum bleeding, or bruises that appear easily even with slight contact. You may also experience prolonged fatigue, frequent colds, or slow recovery after illness. For people with diabetic neuropathy, a lack of vitamin C may worsen symptoms like tingling, sharp pain, or numbness in the hands and feet. On a deeper level, vitamin C is a powerful antioxidant that neutralizes free radicals generated by high blood sugar. If not controlled, these free radicals damage the lining of small blood vessels in the eyes, kidneys, and heart, leading to complications such as diabetic retinopathy, kidney failure, and cardiovascular disease. Additionally, vitamin C plays a role in collagen production, a protein that is crucial for wound healing, skin elasticity, and blood vessel strength. Without enough collagen, diabetic wounds heal more slowly, are more prone to infection, and can easily spread. Another lesser-known benefit of vitamin C is its ability to improve insulin sensitivity. In other words, it helps insulin function more efficiently, allowing blood sugar to decrease naturally. Studies have shown that taking 500 to 1,000 milligrams of vitamin C per day can help people with diabetes lower their fasting blood sugar and HbA1c levels, the average blood sugar over 3 months. So how can you make sure you get enough vitamin C each day? The good news is that vitamin C is found in many common foods that are suitable for people with diabetes. You can boost your intake with red bell peppers, broccoli, kale, strawberries, oranges, kiwi, grapefruit, and fresh lemon. Among these, red bell peppers and broccoli are especially ideal for diabetics because they are rich in vitamin C, low in sugar, and high in fiber. For example, just half a red bell pepper provides around 100 milligrams of vitamin C, nearly the full daily requirement. A medium kiwi contains about 70 to 80 milligrams, and 1 cup of strawberries gives you over 85 milligrams, plus natural antioxidants that benefit your eyes and skin. If you find it difficult to eat enough fruits and vegetables each day, or if you are recovering from an infection, foot ulcer, or experiencing high stress, taking a vitamin C supplement may be a practical choice. Supplement forms such as ascorbic acid or liposomal vitamin C are common and easy to use. For people with diabetes, the recommended dose is usually 500 to 1,000 milligrams per day, but be sure to consult your doctor to adjust the dosage according to your personal needs. However, remember not to exceed the recommended dosage without medical advice. Taking too much vitamin C can cause digestive issues or increase the risk of kidney stones in people with a history of kidney problems. Also, it is best to take vitamin C after meals and combine it with foods rich in flavonoids to enhance absorption and stability in the blood. Finally, maintaining stable blood sugar levels is the key to helping your body use vitamin C more effectively. Keep in mind that vitamin C cannot work well if glucose always dominates the pathway into the cells. That is why eating a balanced diet, exercising regularly, reducing refined sugar, and managing weight are all important factors that go hand in hand. Vitamin C may seem like a simple nutrient, but for someone living with diabetes, it is a shield that protects against infections, cellular aging, and vascular complications. A kiwi smoothie, a plate of green vegetables, or a small daily supplement, these simple choices can strengthen your body and support you throughout this long journey. Dear friend, if you have followed this far, I truly believe that you care deeply about your health, and that alone is already a wonderful step forward. Living with diabetes is not easy. Every day is a journey of managing blood sugar, watching your diet, dealing with fatigue, and sometimes worrying about complications. But please remember this, you are not alone, and you always have the power to improve your health. The 4 vitamins we have just explored together are not magical cures, but they are quiet building blocks that help your body run more smoothly each day. They support your insulin to work better, calm inflammation, repair damage, and strengthen your immune system. And the best part is, you can get most of them from natural foods, or if needed, with guidance from your doctor and proper supplements. Start with the smallest things. A handful of almonds during a snack, a plate of dark green vegetables at dinner, a little morning sunlight on your skin, a glass of fresh orange juice without sugar, 1 vitamin tablet taken at the right time and dose. Each of these is a small but powerful action that helps rebuild your body's protective shield from the inside out. Do not wait for complications to begin before making changes. Take action starting today. Each meal, each step, each good habit will bring you closer to a healthier, lighter, and more fulfilling life, no matter your diabetes. If you found today's message helpful, do not forget to click like and subscribe to the channel so you will not miss the next videos. And if you have a moment, leave a comment below to let me know which vitamin you are using or what topic you would like to learn more about. I am always ready to walk beside you and listen to your health journey. Wishing you health, peace, and confidence in managing your diabetes. See you in the next videos.